you?
Good. How are you? Come on in.
Very, very good. I am done with my first year of med school, so I cannot
Congratulations.
complain.
Yes,
Thank
that's
you.
a great milestone.
So, are you ready for your 73 questions?
I'm ready. Let's do it.
Perfect. Love the enthusiasm. So, what is your name?
Hi, I'm Martha Terrace. I'm Chief of Urology here at Medical College of Georgia at Augusta University.
And how many years have you been practicing?
Over 25.
All those years of wisdom.
Yeah.
So where did you go to undergrad?
Mississippi State,
In medical school?
University of Mississippi.
In residency?
I did general surgery at Duke and urology at Stanford.
Perfect. So, what specialty did you think you were going to go into on your first day of med school?
Urology, actually.
Interesting.
Yeah.
Not many students come into med school leaving with the one they thought they were going to go into.
Yeah, fortunately, I did some shadowing at a little country hospital while I was in undergrad, and one of the general surgeons there led me toward urology, telling me that, they have many women look at it, and he was right.
So, for those who may be interested in going into urology, how long does it take after med school?
It's a 5-year residency program. There's some programs that are still 6, but most are 5.
And are there any fellowships to further specialize within urology?
There's several. Some are a separate board certification, such as pediatric urology, female pelvic medicine, which you can do from OBGYN residency as well, and transplant, which mostly people go general surgery vascular to transplant, but you can do it from urology as well. And then there are the others, such as oncology, endourology, reconstructive urology, that are not a separate board certification.
All right. So, time to put the car salesman cap on and sell the specialty. So, what would you say is the most unique part of urology?
So urology is a specialty that does great surgery. We do phenomenal procedures with phenomenal toys. We've got robots, we've got scopes, and you can be a really serious surgeon, but you don't have to be a jerk. Urologists tend to be really nice people, unlike a lot of surgeons. So if you're a good person and you're a fun person and you enjoy what you do and you don't want to be known as the jerk in the hospital, think about urology.
Yeah. So, why should someone choose your specialty? Just to add on that.
So urology is a great mix of a clinic practice and an OR practice. Again, we've got amazing technology to use. The toys we have can't be beat by any other specialty. And we enjoy going to work every day. I mean, we're a group of people that choose this because it's fun. I mean, nobody chooses to work with genitalia every day just because it's going to give them a great reputation. It's because they enjoy that practice. Work is fun.
All right, flip it around. Why should someone not choose your specialty?
Well, it's actually the same answer. So if you have a strong blush reflex, if you're not comfortable talking to people about intimate things like their sexual function or their fertility issues or how they pee, then it's probably not the right specialty for you.
Well said. Now, are there any stereotypes of your specialty? It's always fun hearing.
Yeah, we love the dick jokes. That's the stereotype.
Well, are the stereotypes true?
Yeah, they are.
Good to hear. So, what does an average day for you look like?
So, depending on the day of the week, so it's either a clinic day or an OR day, and sometimes it's both. So in an academic practice, we'll often have early conferences, teaching conferences with the residents and things like that. But a typical clinic day will start between 8 and 9 and go to 4:30 or 5, whereas the OR starts at 7:30 and goes to whenever the day is done. Sometimes that's early, that 3 o'clock or so, and sometimes it can go later if you've got a big, huge surgery that takes more time.
All right. Well, speaking of surgeries,
yes,
we have an exciting day today.
Yes, we're going to the OR. The only day we could meet was the day that I had cases this afternoon, which gives us more things to show you.
Perfect. Well, let's get down there then.
Good.
So, set the scene. Where are we now?
So this is the pre-op holding. So when a patient has surgery, the first thing they do in the morning is come up here. This is where they change into the lovely hospital gown. They get their vital signs checked. We make sure their consent form and what they think their surgery is as planned. The anesthesia doctors meet them. They get their IV started, all that preparatory stuff before they go down to the OR.
So how long does pre-op usually take?
depends. If it's first case of the day and if they're diabetic and we need to check their sugar or anything before they go down, that's going to take longer than somebody that's completely healthy and you can just go straight down. So it varies with individuals.
So after a pre-op visit, where would you go?
So we would all go down these elevators here and just go straight to the OR. So this is the express to the OR elevator.
So this room looks crazy. Where are we?
So this is the console station for the robot. So in theory, you could be anywhere operating with the robot because the console is where the surgeon is. The robot is in the other room in there. I've got windows, I can see what's going on, but you can be significantly separated from it. Not quite ready for across the country yet because of the lag time, but it does bring up the possibility of remote surgery, which is really exciting. So this is the what we call the console, the cockpit of the robot. And so when I'm operating, I sit in here. I have these are just like a VR station where you would, like if you had a handpiece, and this is like your console, you would look in if you were doing a VR game or something. We have foot pedals that run the cautery, and we can use to move the camera around and stuff. So it's really cool technology, and the magnification and the vision is actually better than your eyeballs. You can get in right on top of the organs, closer than you could sterilely operate, even if you were in there open.
That's awesome. So a few more questions before we kind of see a little bit more of this procedure. Mm-hmm. These are questions that a lot of people need to know before going into specialty. Right. So how many hours do you work in an average week?
I'm an attending, so I have some 12, 14-hour days, but most are closer to 8. And I cover call about one weekend out of every 6. Covering call usually means maybe coming in and rounding for an hour, or coming in if there's an emergency, which may happen every 2 or 3 times on call. But very little. Urology has very few real emergencies that you have to come in for.
What time do you normally wake up?
6 o'clock, sometimes earlier. Maybe one day a week, maybe I get up at 5:30, and then one day maybe I don't get up to 6:30 or 7.
What time do you normally leave the hospital?
On a operative day where things kind of went south, I can be here to 7, 9 o'clock at night. That's unusual. Usually I'm out by, on a clinic day, I'm out by 4:30 or 5. On a OR day, it's closer to 6.
So how many hours of sleep are you typically working on?
7, something like that.
How many hours of sleep are you working on right now?
7.
Okay, good.
Yeah.
So you a nighttime or daytime person?
That's a good question. I am a night person. Okay. Yeah.
So how long does it take for you to chart at the end of the day?
So I will usually take a half day and catch up on a week's worth of charting, rather than spending a little bit of everyday charting. I don't advise that, but that's what works for my schedule.
Everyone has their different methods.
Yeah.
So, who are you most thankful for on your care team?
Oh, the residents, absolutely. They make our lives easier. I can't imagine being in private practice and not having new faces coming in every year that, these fumbled-fingered medical students that you take them from this lump of clay into being a urologist, So being able to do that on top of the patient care really makes my job outstanding.
Gotcha. So what is the funniest thing you've seen in a patient chart without violating HIPAA, of course? And I know urology has to have some interesting ones.
Well, yeah, some of the stuff that patients say or not. But then a resident once wrote in a chart that that they had been asked to see a patient because the team was worried about a very rare urologic disease. And the resident wrote in the chart, "This patient is more likely to get bitten by a shark than to have this disease." It's like, you can't put that in the chart, you know. That's a little unprofessional. Just a little unprofessional, yeah.
The joys of academic medicine.
Yes.
What's the most common medical advice you give to your patients?
Drink more water.
We'll get back to that in one of the later questions.
Watching a master at work.
And sometimes there's some blue that you can't touch also. So stay away from the sterile field. Just kind of be over on that side until we get draped. And once we get draped, it'll be blue, and don't touch the blue. Unless you're scrubbed in, then you can place your hands on the drape or my male stand, which is great. Okay?
Awesome. So today we're replacing an AUS on a patient. This patient had his AUS done less than a year ago, and then suddenly after a surgery he started leaking again. So we had to remove all the components. So you have the cuff. This is what wraps around the urethra, and it wraps like this, and its default is to be inflated. So when they want to be able to pee, they push this pump here, and they'll squeeze this, and it'll pull the fluid out of this cuff and put it into this pressure regulating balloon. And then what happens is this pressure regulating balloon, after a certain amount of time, will push the fluid back down into the cuff. So all they have to do is pump to be able to pee. And we just ask them to do that at least every 4 hours throughout the day. So this gentleman now has a new cuff in, and we're closing him up, and hopefully he'll be leak-free after this.
So how many procedures do you normally do in a day?
How many do I normally do in a day? Ooh, anywhere between 4, sometimes up to 6. On a very busy day.
What's the longest procedure you've ever had to do?
Ooh, a revision of a penile implant, and it took 6 hours because we were so he had priapism because he's a sickle cell patient. He had an implant that eroded, so then we had to put a new one in, and everything kind of scarred down. So it was like excavating out all this like scar tissue. So we completely filleted open his corpora, cut out all the scar tissue, put a new implant in, and then sutured it all in. So it made him a new corpora.
And that was a young patient.
Yes, he was 25 when I did his procedure, which is really young for a penile implant.
So what is your favorite procedure to do?
A penile implant. Oh, okay. Simple, yes. If I could just do penile implants all day, I'd be a very happy woman.
So, fun part's over.
All right.
After you complete a procedure, what's next?
Okay, so first, we have to write orders and document your operative note, and go talk to their family. And the details of that conversation vary very widely, of course, depending on how serious the operation was.
Alrighty. So we've talked a lot about your life inside the hospital. We've seen a lot of what you do in the hospital.
Mm-hmm.
How about your life when you clock out? So what is your favorite thing to do when you're not working?
Make videos.
Is this the time to plug it?
Yeah. So, in fact, you and I met on TikTok before we ever met in person, even though we're at the same medical school. So that's certainly a fun hobby I've had lately.
And you have how many followers now?
15,000, almost knocking on the door of 16. Yeah.
Ooh.
Yeah.
All right. Well, there's your message to go give that a follow.
Yeah.
So, does your family ever ask you for random medical advice?
Not really. They did at first when I was just coming out of med school, and then realized that, I really didn't have that broad knowledge that they were asking me about some random thing. And they didn't take my advice anyway. So I just sort of like, when they started asking advice, I said, you do you. And, because it would hurt my feelings. I would give them advice and they wouldn't take it. So it's like, I put the kibosh on it, to be honest with you.
Yeah. What's the weirdest question a family or friend has ever asked you?
To get them stuff like Viagra.
Oh, okay. That's not what I was thinking.
Yeah. It's just like, okay.
All right. So, what is your favorite food to eat?
Cheeseburgers.
Any favorite restaurants around here?
Oh, lots. Augusta's a wonderful place to eat. Favorite place lately has been Pineapple Inc. I don't know if you've been there yet, but it's a great little restaurant right on Broad Street. Laziza, if you like Mediterranean.
Laziza's fantastic.
Farmhouse, if you like burgers. Taco Sushi. Excellent stuff. So, Augusta's got great restaurants here.
All right. Coffee, tea, or soda?
Soda, 100%.
All right. I always get a different answer from every physician I've talked to. This one I'm the most looking forward to. How much water should you be drinking every day?
So, as long as you didn't ask me how much I drink. So you should drink when you're thirsty.
Okay.
There is no magic number. So if you're having a really sweaty day, you're going to be more thirsty. Unless you've got some disease like diabetes insipidus or something so that your thirst mechanism's wonky. Your body's smart. It tells you when you need water.
You heard it here first.
Yeah.
The urologist. I say that's the the final answer. So, favorite meal from the hospital cafeteria if you have one?
Their breakfast is awesome. The turkey sausage.
Favorite healthy snack?
Healthy snack. Edamame, is that healthy?
Yeah, I'd say so.
All right.
So, what's your favorite guilty snack or cheat meal?
Chocolate chip cookies.
Classic.
Yeah.
All right. Pineapple on pizza, yes or no? Controversial question.
Yes.
Okay.
Yes. Not a favorite, but it doesn't. You don't throw the pizza out just because it's got it.
Apple or Android?
Oh man, hard. BlackBerry.
Wow, all right.
It broke my heart. They went under. But so I've gone back and forth between Apple and Android since. I'm an Apple person now, but I miss a keyboard. Boy, I love that keyboard.
I have not heard that one yet. That's awesome. Well, I was gonna ask if you have any artistic hobbies you keep up with, but obviously
You know the answer to that. Yes.
TikTok.
Yeah.
What kind of music do you listen to?
80s rock and roll.
80s
80s rock and roll. Yeah.
Perfect. So, what is the best way that you relax after a long day?
Good book, sunset, comfortable chair. Yeah.
Simple.
Yeah.
Night in or go out on the town kind of person?
Night in. Yeah.
Indoor-
Put that good book in the comfortable chair. Yeah.
Makes sense.
Yeah.
So, indoors or outdoors?
Indoors.
Beach or mountains?
Mountains.
Would you consider yourself more of an introvert or an extrovert?
Introvert. Introverted, extrovert. One of those
Yes.
those people that can play extrovert but are internally introvert.
Most definitely.
Yeah.
So would you say that personality trait was a factor in you choosing your specialty?
No.
All right. So we are getting close to the end. We only have
Okay.
a few more questions left,
All right.
but these are going to be more reflective.
All right.
So what did you think you were going to be when you grew up as a kid?
Always knew I was going to be a doctor. Don't know why. Nobody in my family is that. But early on, thought it was going to be a girly thing, like a pediatrician or OB, But yeah, dropped that after childhood.
Is there a different specialty you think you could have done?
Anything surgical, I would have been, I could have been successful at. I wouldn't have enjoyed it as much as I'd enjoy urology, but I could have had a good career at anything technical, I think.
If you didn't do medicine, what do you think you'd be doing right now?
That's a good one. Probably like software engineering or something like that.
Okay. All right. So the medical field is hard. Everybody that's gone through it knows it. Were there any times you doubted you would make it as a doctor?
No.
That's
People talk about imposter syndrome and things like that, and I'm just like, is something wrong with me that I never had that? I just don't. I don't understand.
I think that's a blessing.
Yeah.
Confidence is key going through it. If you could change one thing about the medical field right now, what would it be?
Paperwork, insurance companies, and pre-approvals, and the EMR, which I all lump together as in the administrative paperwork component of it.
Now, what can a medical student do right now to prepare to go into this specialty?
Just do your work, right? So learn the stuff you're supposed to learn as a first and second year student. You've got to get the vocabulary down. You've got to know the anatomy. You've got to know the physiology, the pharmacology, that's the building blocks. And after that, then yes, shadow, learn how to tie, practice your tying. All of those sorts of things sort of come into play your third and fourth year. But you've got to have the building blocks. And Andy and I have talked about the fact that many students are like so gung-ho to do some research or something way above their level of education early on. And you need those building blocks. Focus on that. That's critical. Somebody that skips over some of that, it's telling when they get to their clinical rotations.
Well said. And we are down to our last question. Finally, what would you say to the aspiring urologist right now?
Hang in there. It's so much fun. It's so much fun. You'll enjoy it. Even here I am, decades into it, and still love it every day.
That's awesome. Well, thank you so much, Dr. Terrace. That is all I have for you. I know you were busy, so I'll let you get back to it.
Thanks so much.